Are you suffering from Covid-19 and you are at home isolation? Or do you know anybody who is suffering from Covid-19 and is at home isolation? If yes, this video is for you. Keep watching. Hello all and welcome to our channel Let's Speak, and I am Gunajit Sharma, your host. So today we'll be discussing about home isolation care for COVID positive people, and we have Dr. Rinki Das with us, who will be walking us through the do's and don'ts for COVID-19 at home isolation. So you can find the details regarding Dr. Rinki Das in the section below. So let's begin.
Hi, I'm Dr. Rinki Das. I am an intensivist. 2022, we are again hit with the third wave of COVID. Now, everybody today knows what are the signs and symptoms of COVID. But the question that is there in everybody's mind is, what should I do if I test COVID positive? In this wave, unlike the first and the second wave, we see that most of the patients are eligible for home isolation with mild and moderate symptoms. So the question that comes to everybody's mind is what I should do now at my home isolation. Am I safe enough to stay in the home isolation? So here we will discuss the guidelines meant for the patient and the caretakers to maintain the norms of COVID behaviors. So the first thing is to isolate yourself from the other members of the family as soon as you have signs and symptoms of COVID. You should stay in a well-ventilated room, use a triple-layered mask all the time, drink a lot of water and take rest. Hand washing and using sanitizer should be done very, very frequently. Do not share your used items or personal items like your utensils with the rest of the family. Ensure that the surfaces you touched are very frequently cleaned. The most important part is to self-monitor yourself. The oxygen saturation levels, the temperature should be monitored every 4th hour. So when there is a family member who is COVID positive, there has to be somebody who takes care of the patients occasionally and as and when needed. So here are the instructions which are to be followed by the caregiver when they come in contact or they are in the same room as that of the COVID positive patients. First and foremost important thing is to wear a mask. The mask could be a triple layer mask or an N95 mask. The front portion of the mask should not be touched upon. The mask has to be discarded after cutting into pieces and after keeping in a plastic bag for at least 72 hours. The front portion of the mask should not be touched, and after removing the mask, the patient's caregiver should follow the hand hygiene norms. For the hand hygiene norms, the patient's caretaker has to wash the hand with soap solution for minimum 40 seconds. The other option is to use an alcohol-based hand sanitizer and clean the hands thoroughly. So what is the treatment for the patients who are at home isolation for COVID-19? These patients are generally having mild, moderate symptoms or they are asymptomatic. So the first and the foremost thing is to keep in touch with a treating medical officer and report to them in case of any deterioration of your health. You can continue all your medication for your other comorbidity and illness which you were taking previously, and continue medications which are for fever, running nose and cough. Perform warm water gargling and take steam inhalation thrice a day. Now, if even after taking the medications your fever does not settle, this is the time you need to get back to your treating doctor. Do we need the investigations to be done? The investigations are to be done only after consultation with a doctor, and the CT scan of the chest is also not required immediately as you are COVID positive. It has to be done only after consulting a doctor in case of a desaturation or other symptoms. Do not use any steroids, do not self-medicate, unless you discuss it with a doctor or the doctor prescribes it for you. Now, when should you ask for medical attention or you have to ask for an hospitalization? Number one, when you're self-monitoring yourself, you have to keep and check on your temperature. And if the temperature is high grade, unresolved, more than 100 degree Fahrenheit for more than 4 days, if you have a difficulty in breathing, if your oxygen saturation falls below 93% on the room air, at least 3 readings within an hour, or your respiratory rate goes higher than 30 per minute, or if you have some pain or pressure over the chest area, if you have any mental confusion, or if you are drowsy, if you have severe fatigue and myalgia, this is the time you call for medical attention. So when do we end the home isolation? So the end of home isolation is after at least 7 days from the day when you test positive, or if there is no fevers for successive 3 days. Now, when we end the home isolation, do we have to test our COVID status again? No, it is not required. You have to continue wearing mask and continue the COVID appropriate behaviors even if you are out of the home isolation. And last but not the least, how do you dispose the biomedical waste that is formed in the room of the COVID patient? Now, the mask used, the gloves used, the tissue contaminated with the blood or any body fluids of the patient is considered as a biomedical waste. We need to collect those waste in a bag, a preferably yellow bag, and tie it securely before you hand it over to the waste collectors. So this is for the safety of the people who collect the waste and to make sure that the environment is COVID free.
So thank you for watching our video, and we hope that our video will help you in some way. If you found our video informative, please do like and subscribe our channel. Thank you.